Hello everyone, my name is Jahanara Akhtar and today I will be presenting on the topics how do you define healthcare leadership for my course Healthcare Leadership 601. So this is the first slide where I will be discussing about how do we define healthcare leadership. Healthcare leadership is more than managing a healthcare facility or supervising employees. It is the ability to guide healthcare organizations, teams, and professionals towards providing safe, effective, ethical, and patient centered care. A healthcare leader creates a vision, supports employees, encourages innovation, and ensures that patients receive the highest quality of care. In my opinion, healthcare leadership means balancing organizational responsibilities and compassion and responsibility towards patient and healthcare workers. Effective leaders directly influence patient outcomes, employee satisfaction, and overall success of healthcare organization. And this is the second slide where I will be discussing about importance of healthcare leadership. So why healthcare leadership matters? Healthcare leadership is important because healthcare organization faces many challenges, including increasing healthcare cost, workforce shortage, technological changes, and higher patient expectations. Healthcare leaders are responsible for improving patient outcomes, supporting healthcare professionals, managing changes, maintain ethical standard, and creating a positive workplace culture. A strong healthcare leaders must make effective decisions, solve problems, communicate clearly, and motivate employees while keeping patients as the main priority. Leadership is important because healthcare is not only about medical medicine treatment. It is also about creating systems and provide safe, respectful, and accessible care for every patient. Innovation in healthcare leadership. The first essential elements of healthcare leadership is innovation. Healthcare is constantly changing, and leaders must support new ideas and technologies to improve healthcare delivery. Healthcare leaders promote innovation by implementing new technologies, supporting evidence based practices, improving healthcare systems, and encouraging employees to develop creative solutions. Example of healthcare innovation including electronic health records, telemedicine, artificial intelligence in diagnosis, and remote patients monitoring. This innovation improve efficiency, increase access to healthcare services, and allow providers to deliver more personalized patient care. And effective healthcare leaders understand that healthcare organization must continue improving to meet future challenges. Safety and compliance. The second important element is safety and compliance. Patient safety is one of the most important responsibilities of healthcare leaders. Leaders must develop systems that reduce medical errors, protect patients, and ensure healthcare organizations follow legal and ethical requirements. Healthcare leaders focus on patient safety standards, regulatory compliance, quality improvement programs, and ethical healthcare practices. Examples include infection prevention program, medication safety procedures, protecting patient privacy, and following healthcare regulations. A strong safety culture allows employees to report problem without fear and helps organization continuously improve their services. Healthcare leaders must always remember that every decision can directly affect patients' lives. Next slides, I will be discussing about adaptability in healthcare leader. The third essential quality of healthcare leadership is adaptability. Healthcare environment changes quickly because of new technologies, healthcare policies, patient needs, and unexpected emergencies. An adaptable healthcare leader must be willing to learn continuously, support organizational changes, communicate effectively, and help employees manage uncertainty. The COVID 19 pandemic showed the importance of adaptable healthcare leaders. Leaders had to quick adjust strategies, manage resources, and protect both patient and healthcare workers. Adaptability allows healthcare organizations to remain effective during difficult situations and continue providing quality care. In my next slides, it will be about employees' engagement and retention. The fourth essential elements is employee engagement and retentions. Healthcare employees are the foundation of every healthcare organization. Nurses, doctors, technicians, and support staff all contribute to patient care. Healthcare leaders improve employees' engagement by creating supportive work environment, recognizing employees' contributions, encouraging professionals' development, and maintaining effective communications. When employees feel valued and supported, they become more motivated and committed to their organization. Engaged employees provide better patient care, improve teamwork, and are more likely to remain with the organizations. Therefore, healthcare leaders must focus not only patient but also people who provide health care services. In my next slides, I will discuss about the prevention. The fifth essential element of healthcare leadership is prevention. Healthcare leaders should focus not only the treating diseases but also on preventing illnesses before they become serious. Prevention strategies includes health education, early disease detection, vaccination programs, community health initiatives, and wellness programs. Preventive healthcare improves population health and reduces long-term healthcare costs. A successful healthcare leaders understand that promoting healthy behavior and preventing disease creates better outcomes for individual and communities. Prevention represents a proactive approach to healthcare leaderships. Healthcare leadership impact on patients. Effective healthcare leadership improves Effective healthcare leadership has a direct impact on patient. Strong leaders improve quality of care, increases patient trust, improve safety outcomes, expand access to healthcare, and create better patient experience. Healthcare decisions are not only administrative decisions, they affect real people and their lives. Patient centered leadership means understanding patient needs, respecting their values, and ensuring that healthcare services are safe and compassionate. The ultimate goal of healthcare leadership is improving the health and well-being of individuals and communities. And what healthcare leadership means to me. In these slides, I will discuss about it. To me, healthcare leadership means guiding people with compassion, knowledge, and responsibility to improve healthcare outcomes. A healthcare leader should inspire employees, support innovation, maintain safety standard, and always put patient first. The qualities I believe are important for healthcare leaders include compassion, integrity, communications, accountability, and vision. A leader does not simply give instruction. A true healthcare leader listens, supports others, and creates an environment where both employees and patient can succeed. Conclusion, this is the last slides for my presentation. In conclusion, healthcare leadership is much more than managing healthcare organization. It is about creating positive changes through innovation, safety and compliance, adaptability, employee engagement, and prevention. Strong healthcare leaders connect people, technology, and healthcare system to improve patient outcomes and strengthen healthcare organization. The future of healthcare requires leaders who is flexible, ethical, innovative, and patient focused. So this is all for my presentation. Thank you so much for listening. And the last slides, there is a reference. The information used in this presentation was supported by healthcare leadership and patient safety research, including resources from the World Health Organization, Institute of Medicine, and Healthcare Leadership Studies. Thank you so much. Thank you, everyone.